And I think with what Dr. Emans just said is why it speaks volumes about having as many team members as you can being a part of this comprehensive health assessment, right? I mean, because if you've got it where the surgeons can articulate, that's what we think is going to happen. From a blood loss standpoint, you have the pulmonologist weighing in saying, yes, this is what's going to happen respiratory-wise. You have nutrition, like whoever. The parents are weighing in about what their concerns are. You're able to, again, have this overarching assessment of what are the health issues that could compromise this child's perioperative health and safety. And putting those together concisely in written text where everyone can see that and start to digest it and take a step back and say, knowing that, then are we good to proceed? Are there things that we can do to tweak this that would change this assessment a bit and make us feel better? Or is this what we have? Is unbelievably important. It's almost like that's one of the core features, I think, of even informed consent for the surgery itself, of being able to list that out and marry that so that everyone knows what might happen.
And also, some of the process is transparent. A lot of it is transparent, but some of it is behind the scenes. I felt really assured going to Dr. Emans and knowing what were his top specialists he would want to be connecting with, and knowing these are kind of the key areas. I also know prior to going into surgery, when the anesthesiologist nurse was going through his file, she was like, oh, there's lots of emails in here with lots of conversations happening between the different specialists, which I sense was happening, but I didn't know until that moment. Like, I was having good conversations and reaching out and talking to people, but there was also this internal communication happening to assure that, things were going to go well.
Do you think that was not transparent enough? Did you
feel
left out of the loop?
It wasn't so much about being left out of the loop. I think I would have been more assured that things were being communicated had I known the extent that, the specialists were communicating with each other.
It's interesting to me that you feel comforted by that, because I think at no point almost do I ever feel comfortable with the whole process. You'd think I'd feel comfortable with the surgery, but I don't. I'm anxious about the surgery, trying to make sure that we have really worried about everything, that there isn't something that we missed. Is there something we should be doing better or doing differently? Is there something we potentially missed? So I'm just interested that you feel increasingly comforted the more people see. I find myself increasingly worried the closer you get to the actual process. So
I think because in my experience, increased communication with situations that involve will have always produced better outcomes. So I think hearing that there was more communication happening would assure me that things were being discussed and talked about and covered.
I think the times that I feel better about things are when I know that the healthcare team has been thoughtful about their assessments. It's one thing to check off a box and say that cardiology evaluated this child, and you've got a note, and we're all set. That's one thing, but actually reading the quality of what they've done and where you feel reassured that they've really gone through and thought about what they needed to think about. And it's very unnerving because a lot of the times, I don't have the expertise to actually know exactly what they should be thinking about, but I know they should be thinking, right? And when you have times of this email communication where someone says, oh, I think Will's fine for surgery, and that's all you get, and it's on their iPhone in blue text while they're driving, like that's one thing, versus someone that says, I'm going to review his chart, let me get back to you tomorrow, and then comes back with, and there's some paragraphs. Then you're okay, now we've got someone engaged, let's keep it going, and come up with a thoughtful assessment that's really going to help him.